I'm Matteo Tozzi. I'm a full professor of vascular surgery at University of Insubria and SST Sette Laghi Hospital in Varese, Lombardy, Italy. Today is most important in my practice. I start my utilization of DCB in 2013, and today, after more 1,000 patients treated with DCB, I have the clinical evidence shifted my daily practice about the important in the treatment and the cure of neointimal hyperplasia in all the localization of the vascular arches, so in juxtaanastomotic area, in cephalic arch, in venous flow, in central vein stenosis. And each year increase the possibility, with the help of different devices, the use of DCB in this particular field. As a vascular surgeon, treat patients in hemodialysis for a malfunction or for a failure of the vascular arches. Our goal is the patency of the circuit. And today, the patients in hemodialysis survive long time. So our goal is maintain the patency and utilize for a longer time possible the circuit. So today, with a closed follow-up and with the maintenance of DCB, this goal is achieved. In our clinical practice, more than 50% of patients at 1 year have a circuit patent without rethrombosis and without restenosis after the treatment of DCB. And this is most important because my previous experience with PTA alone is dramatically 0 patients at 1 year have the circuit patent. So the better outcome today with DCB is incredible. So this is the best important. The time, yes, it's not, the DCB is not the final cure for neointimal hyperplasia. This is mandatory to have in mind. But the time from a treatment to other is more long. In our study, in publication Aperto 600, so 600 DCB balloon treated, the mean time from a treatment to the second treatment is 8 months. So the patients, all patients, underwent only 1 treatment for a year, and only the 6% of patients underwent 2 or more procedures. So this is most important for the patients because less time in hospital. For the surgeon or for interventional radiologists, reduce the number of treatment for each patient. So most important for all the team that perform and that follow the patients in hemodialysis. In the last six months, I start a collaboration with Luke University, an Italian economic university of Milan. In this collaboration, our focus is this: underline the cost benefit with the treatment of DCB in the vascular arches failure population. So, and today we have the preliminary result, incredible and positive preliminary result. We perform a comparison of 2 scenarios. The first scenario is a patient with a stenosis of vascular arches treated with PTA alone, and the second scenario, naturally, is PTA with DCB. So, first of all, this work is based on the evidence in the literature, so based on a very deeper meta-analysis of the literature, and in the second, with the real data of our center, with the data of Aperto 600. So, first of all, the preliminary result. The percentage of retreatment for each patient for a year is naturally positive for DCB arm compared to PTA alone. Second, less hospitalization time for the patients of the DCB for DCB because the number of restenosis is less. if this number is incredible, it's possible to have different point of view. From the healthcare system, the advantages is less money spent for retreatment of the patients. Second, for environment, less CO2 spent from the patients for come continuously in the hospital for perform new therapy. And another point of view, very important, more number of beds in the hospital for new patients. Because if I reduce the number of retreatment for the chronic patients, I have more possibility to treat new patients. So I reduce the waiting list of the patients, and probably in my year, the patients waiting list in Varese underwent the treatment faster compared in our previous experience 15 years ago. The guideline for us is very important. Each guideline is based on the evidence from the literature. I think today for the DCB we have some different fantastic paper, randomized control trial with maximum level of evidence. Naturally, this paper is industry sponsored, but it's normal in the medical device. So I think the scientific community waiting an indication or a consideration of the DCB treatment in this field of pathology of vascular access. This is most important from ethical point of view, from cost effectiveness for the healthcare system. Is very important to have a perfect allocation of the money and the perfect allocation of our resource. Treat more patients with less money. So I think today is most important problem to the correct allocation of the resource. And today the DCB is the first line treatment for the stenosis and for the failure of the vascular access of more patients in hemodialysis.